Hello, my name is Anvo and I am at Kaiser Riverside Hospital. I have abdomen series. So our protocol include PHS, KUB upright and KUB supine. So for the technique, I will use 80 kVp at 50 to 60 mass. If big patient, so I will bump like 120 mass. And for the chest, I will use the AEC for the technique. And before I take my patient in the room, so I will repair everything first and I clean everything. So this one is shielding for my patient. And I will use the IR is 14 times 17 lengthwise for the abdomen and 14 times 17 crosswise for the chest. Okay, so now I clean it. So for SID, the abdomen is 40 inches, the chest 72 inches. And now I will take my patient in, okay? Cat, quiet. Hello, Cat.
Hello.
How are you, Cat?
Good.
My name is Anne. I will do your exam today. And go ahead and give me your full name, your birthday.
Cat Watt, February 23rd, 1982.
Okay, can I see your wristband? Thank you. Today you have your belly exam. Okay. Can you tell me what happened to your stomach?
My stomach hurts.
Oh, stomach hurt. Okay. For your exam, I will take three view. The first one include your chest and your abdomen. You will stand right here, and then the other one you will lie down on the table for me. Okay. And the first one I will do for you the chest first, and then the abdomen upright first. Standing right here first. Okay. And can you stand right here for me? Oh, let me wash my hand first, okay, Kat? Sorry. So I will wash my hand for 20 seconds. And I will put the new glove. Sorry. So my patient, they already in the gown, okay? Okay, Kat, the first one I need you stand right here, facing to the board for me. Perfect, right there. Put your hand on your side. No, just relax right there. Yeah. Oops. And I get this one, the shielding. Kat, I put this one, the shielding for your gonad, okay? So I will do the chest and I adjust until the CR is like perpendicular, like above at the T7, the inferior scapula is right here. And I try to tell the patient to draw their shoulder forward to get the scapula out of the lung field. Okay, Kat, chin up a little bit for me. And can you draw your shoulder forward like that for me? Perfect. And I put the lab marker right here. So the SID is 72 inches. And I column A include the shoulder and include the both side right here. I check no rotate, no tilt. Okay, Kat, can you take a big deep breath in? Blow it all the way out. And take another big deep breath in and hold. Ashtray. Okay, breathe. Go ahead, relax, cat. Okay. And now I will do the abdomen. So I will move the SID like 40 inches. And the bucky, the IR, I will use a lengthwise 14 times 17. Can you turn and facing to me? Okay. So I will put the marker, the left side is right there. I will adjust my patient in the middle of the bucky. Right there, cat. So I will adjust the CR is like above 2 inches of the iliac crest. And I try to shield my patients not in the anatomy. Can I put this one as shielding for your gonads, okay? So below right here. Okay, I will touch your hip, okay, cat? Okay, the iliac crest right here, and then 2 inches. So the CR at 2 inches above the iliac crest right there. And open wide on the top and bottom. And my marker on the left side. Okay, cat. Hold your breath. Ashtray. Breathe. Okay. So now I will tell my patients lie down on the table. Tắt đi con. Okay, cat. So I need you lie down on the table. First, I have you sit down first on the table. Lie down on your back, your head over there. Okay. Can you scoop in a little bit? Right there, perfect. For this one, I use the IR like 14 times 17 lengthwise. And this one my shielding. Cat, I put this one shield for your gonads, okay? So I put the left marker at the corner right here, the bottom one. And I adjust the SID to 40 inches. And I try to align to the bucky and deepen to the bucky. Okay, so for the CR, perpendicular to at the iliac crest. It's right here. Cat, I will touch your hip, okay? Okay, at the iliac right here. I will adjust my patient and the CR at right there. So I will check again. So calm me a little bit on the left marker at the bottom corner and shielding. And I put my patient hand on the side right here. So for the abdomen, I will use like 80 kVp at, I think my patient at 90 mass. Okay. Okay, cat. Now can you hold your breath? Ashtray. Go ahead, relax, cat. Breathe and relax. So I check my image. If they include the top, they include the shadow of the kidney and the pubic symphysis. So I don't need to do another view. But if my patient here they told and I cannot include everything on one view, so I have to do another view. But I already checked the film, so they have included everything. So I just do one view. Okay, guys. So we all done. Okay, then I take this one out for you. And do you need help to get up?
No.
Okay. So for your exam, I have all your picture. So later I will send your picture to the radiologist, and they will write the report to the memory doctor. It takes about 3 or 4 days. Okay. Do you have any questions?
No.
Okay. Thank you, Kat. Have a
Thank
good
you.
day. Thanks. Eval image for the abdomen series. For the chest, anti-lung field from the apex to the costogenic angle. So no rotate the equal distance from the vertebral column and the lateral border of the rib on the each side. So the trachea visible in the midline and the end of the sternum end of the clavicle equidistant from the vertebral column. So the scapula protected outside of the lung field. For the good inspiration, show 10 posterior rib above the diaphragm. And for the abdomen upright, we have to include the diagram. Include the diagram to check like if the air fluid and the area from the for the supply. For the supply abdomen, the area from the pubic symphysis to the upper abdomen. No rotate, check for no rotation. The spinous process in the center of the lumbar vertebra. The wing of the ilia symmetric and sharply define the outline of the kidney and the pulse, no, the sore muscle, the lower border of the liver and the kidney. Thank you.